So what are your thoughts here? I think the last time you and I spoke, you were keeping a close eye on what the fall was going to look like. Now, of course, people being able to come into Canada, we haven't gotten official confirmation yet, but it's looking likely that some of those vaccine mandates, the ArriveCan app, for example, will not be required anymore.
Yeah, so I think there's kind of two main pieces in here, ArriveCan and the vaccine mandate. So with respect to the vaccine mandate for people coming into the country, what this effectively will mean is that individuals that are coming in may be at a higher risk for having severe disease. And of course, that actually poses a bit of a more of a risk to our healthcare system, which we already know is struggling right now. The level of risk itself, I think, has yet to be determined. But then the other aspect as well is the ArriveCan app, which, for all intents and purposes, I think has actually worked pretty well and has been a fairly good example for other countries. I know the United States, for instance, has just started their own border security app, actually. That said, both the restrictions and also the border app, they target uh, they kind of unfairly target people from low middle income countries and also people who are not so tech savvy. So it does make it harder for people to enter the country if they're from low and middle income countries, haven't had access to vaccines, and also if they're maybe not as adept at using apps. So there are steps in the right direction, but I think that the biggest focus is that our healthcare system really does need to be shorn up a little bit because it's struggling.
So what would your advice be then if you were sitting at the table then with the health minister, with advisors and whatnot, transportation minister as well, and saying, okay, from a medical perspective here is what here's what my best advice would be in order for us to do what we need to do to keep Canadians, people safe?
Yeah, so I think two things. Number one, things that really are already being done is really encouragement of booster shots with the bivalent vaccine and also masks, really encouragement of those sorts of things to help decrease some of the severity of disease, so to decrease some of the stress on the healthcare system, but to take the money that was being put into development of these apps and ongoing effort with these apps, for example, and put that money into the healthcare system. The healthcare system is really, really struggling right now. And restrictions in terms of being able to pay nurses, for instance. If you're looking at nurses' wages of what, $40 an hour, compared with paying traveling nurses and their agencies, which will get upwards of $250 an hour, it's crazy. To be able to be funding the healthcare system in this way, and people are really, really struggling. Hospitals are struggling, and I think that they're not able to be separated. And that's, I think, where we need to go with this extra money that will be saved from not promoting the app.
Really quickly then, what about masking? I mean, I know, again, there has to be the hard push on the healthcare system, but it's also part and parcel of keeping people out of the ER, out of hospitals. So what about masking? What would you say?
Yeah, wear your mask when you're indoors, when you're in public places. Just wear it. Any little bit helps, and it'll decrease the risk of spreading the disease if you know that you have it or not, and it'll help reduce the risk of you contracting the disease. That's whether you're in any sort of indoor public place, be it on planes, which I'm hopeful that we're going to continue that mandate actually, but also when you're just in a mall. If you're walking in the hospital right now, we still have to wear masks, but just wear them. It doesn't hurt people. It helps people out, and really, I think, will improve safety for everybody.
Indeed, and we also have flu season coming up as well, so we can hopefully keep those
Oh
numbers
yeah,
down as well.
get your vaccine. Please get
Yeah.
COVID vaccines. Get your flu vaccine. These things all help us stay safe and also help that stress on the healthcare system.